Good afternoon, everyone. My name is Sarah Tomkison, and I'm a social worker and part of our Geri Echo Hub team. I'd like to, before I introduce the other Hub team members, I want to acknowledge sponsorship of our Geri Echo by the Queen's Medical Center and the University of Hawaii Jabsum Department of Geriatric Medicine. Joining me this afternoon with the Geriatric Hub are Dr. Lucas Morgan, psychologist, Dr. Reese Ueno, pharmacist, Dr. Rita Bell, our geriatrician, Chris Vale, our physical therapist, and last but not least, Dr. Courtney Nunukawa, our advanced practice nurse practitioner. So please join me in welcoming them. As a reminder, evaluations for CMAs, you can find the evaluations by following the link in the chat or at any time on our website and email advertisement. We are currently offering continuing medical education for MDs, DOs, RNs, APRNs, and physician assistants. The good news is we're happy to announce that you can download your own CME certificates anytime by going to the Queen's Medical Center's website at www.queens.org and typing CME in the search tool. And there you can pull up your transcript, sign, and generate your certificates. So just as a reminder, annual transcripts will no longer be sent out by the Queen's Medical Center. Your comments and suggestions are very important to us in Geri Echo for the purposes of for the planning committee of planning future programs. We want to emphasize that this Echo webinar serves as a forum of mutual teaching from subject matter experts and from each of us on the front lines, which is you, the participants. As the Echo motto goes, all teach, all learn. And in the spirit of aloha, we would like to encourage you to turn on your cameras to help us build a community of learning. And feel free to eat your lunch during this Echo session, for good nutrition is key to a healthy lifestyle. Our webinar format consists of a short lecture from our guest presenter today, followed by open comments from the expertise of the Echo Hub team I introduced you to. Then you, the participants, your comments, your questions, and even examples for case discussions are greatly valued and welcomed. Lastly, we ask that you please keep all case discussions HIPAA compliant. This includes not sharing the patient's name, their birth date, address, and so on. We learn best from our patients and our clients. They are our best teachers. It is a great pleasure, with great pleasure, that I'd like to introduce today's distinguished speaker. It is Mr. Glenn Higa. He's a fitness therapist and also a certified personal trainer. He offers both in-person and online personal training for persons living with Parkinson's disease. He's the owner of Make It Happen Personal Training. Glenn has also served as the president of Hawaii Parkinson's Association, and under his leadership, he has led to fundraising, increased public education and awareness, and actually taken an active role in policy making. He received his Bachelor of Arts in Public Relations Journalism at the University of Hawaii. Please join me in welcoming Glenn, and thank you for sharing your knowledge, Glenn, and wisdom with us.
Thank you, Sarah. Thank you. Welcome, everybody. It's a pleasure to be here, and thank you for the opportunity to talk about Parkinson's disease and living well with it. So I'm going to start to share my screen real quick. Okay. Okay, so what is Parkinson's disease? Okay, so Parkinson's is a progressive neurodegenerative disorder affecting the dopamine-producing neurons. It's generally clinically diagnosed by a neurologist with an emphasis on identifying symptoms. Primarily, symptoms they include tremors, bradykinesia, and rigidity. Therapies and treatment include medication, exercise, and lifestyle changes. Primary risk factor is age, with average age of onset being about 60 years old. There is no cure for Parkinson's. However, such as medication and exercise can reduce symptoms and improve quality of life and allow for activities of daily living. So what are the symptoms? So potential early symptoms include restless leg syndrome, loss of sense of smell, constipation, drooling, and masked face. Motor symptoms include tremors, rigidity, bradykinesia or slow movements, micrographia or small handwriting, swallowing issues, postural instability, and facial masking. Non-motor symptoms include physical and mental fatigue, loss of sense of smell, hallucinations, apathy, anxiety, insomnia, and depression. There are over 40 motor and non-motor symptoms attached to Parkinson's disease. So when you say that if you've seen one Parkinson patient, you've seen one Parkinson patient, that's the reason why. Okay, everyone, everyone projects differently. Okay, so who has Parkinson's? Okay, there are an estimated 8,000 people in Hawaii that have Parkinson's. According to the Queens Medical Center, Parkinson and Movement Disorder Center, that number is projected to double by 2030, so just 5 years, projected to double. There are 1 million people in the US that have Parkinson's. That number is projected to go to 1.2 million by 2030. 90,000 people each year get diagnosed with Parkinson's in the United States, and that's up 50% in the last 10 years. And one person every 6 minutes is diagnosed with Parkinson's. It's more common in men. It's the most common motor brain disease right now. 1% of those over 60 years old worldwide have Parkinson's. And it's now considered the fastest growing neurological condition in the world. So what causes Parkinson's? Well, genetics is the only confirmed cause of Parkinson's that genetics is the only confirmed cause of Parkinson's, with 10 to 15% of diagnosed cases attributed to genetics. There are other factors associated with Parkinson's that are anecdotal, including exposure to pesticides, chemicals, tainted water, even where you live. Some cases have also been linked to head injuries, including excuse me, combat veterans from IED, the roadside bombs, and they've been experiencing in places like the Gulf War, during the Gulf War. Boxers, football players. If you think Muhammad Ali, remember Muhammad Ali had Parkinsonism. That's another way. Okay. So what are the medication options? Levodopa is the most prescribed medication for Parkinson's. It has been the gold standard for medication for Parkinson's for over 40 years now. Increases the available level of dopamine, and it's almost always effective. Okay. Not everyone can tolerate levodopa, and some may need other types of medication, such as dopamine agonists. Dopamine agonists mimic the effects of dopamine in the brain. Some common examples of dopamine agonists are pramipexole, ropinirole, and lotigotine. Other types of medications include MAO-B inhibitors such as misageline, COMT inhibitors such as entacapone, and NMDA receptor agonists such as amantadine. So the downside of the medication is the side effects, and not everyone experiences side effects, but the ones that do, most notably for levodopa, the most notably side effects are orthostatic hypotension or low blood pressure, dyskinesia, which is uncontrollable movements, and nausea. Side effects from dopamine agonists are some of the most severe side effects and they include impulse control disorders such as gambling, hypersexuality, and and compulsive shopping. Fatigue, sudden sleep attacks, and cognitive impairment are also potential side effects of from dopamine agonists. Other medications have the following side effects: insomnia, dry mouth, blurred vision, and heartburn. So those are the side effects. So I included a quote here because they're going to talk about some treatments, okay, that other than medication. So the first one on the left says, if exercise can be packaged in a pill, it would be the single most widely prescribed and beneficial medicine in the world. That tells you about the level of enthusiasm most people have for have for exercise. The one on the right I really like. This: prevent a heart attack, take one aspirin per day, take it out for a run, take it to the gym, and then take it for a bike ride. So I'll talk more in depth about exercise when I talk about my own personal journey with Parkinson's, but this is a must-do for everyone with Parkinson's. It's the only therapy proven to slow or even delay the progression of Parkinson's. It's beneficial exercise comes in many forms, and the Parkinson's Foundation recommends different modes of exercise, including walking, jogging, high intensity training, strength training, yoga, and Tai Chi. However you do it, my advice is the best exercise is one that you would do daily and that you enjoy. Okay, so that's my personal advice in terms of exercise. Another therapy that is very important is social interaction. Parkinson's can be a lonely and isolating condition, so staying socially active is important. Some ways to accomplish this is to join a support group, participate in a group exercise class, and engage with others who have or don't have Parkinson's. Speech therapy is also very beneficial for people with Parkinson's, as pneumonia and asphyxiation are some of the leading causes of death in people with Parkinson's. Soft and low voice are also common symptoms of Parkinson's, and that also leads to a lot to social lack of social interaction. When you talk, when you're speaking to in public, and people can't hear you, they tend to get shy away from participating in society. Finally, there are invasive and non-invasive medical procedures available. Deep brain stimulation, or DBS, involves two electrode leads that are implanted in the brain and attached to a pacemaker-like device to regulate motor symptoms. This has been a pretty common procedure. It's been done for about 30 years now, and it's actually advanced to the point with now with AI technology where most people with DBS, they can manually adjust the sensors, okay, to produce how much electrical current that they need to affect the brain. Now with AI, they have adaptive DBS now. So what happens now is that the pacemaker like device will actually read and understand what levels that needs to be done for people to live well with Parkinson's. Focus ultrasound has recently been improved for use in reducing motor symptoms as well. Finally, there is a subcutaneous infusion therapy called or enteral suspension, which is known in the market as Duopa. It's similar to an insulin pump as it delivers the levodopa directly into the bloodstream. And there's a next generation pump that just entered the market known as Vialis. So, who am I and what is my journey of a lifetime? So, how did I get here? So, I was born and raised and still live in Kali. I'm a local boy, a brother, an uncle. Together with my girlfriend, we have raised our twin stepdaughters, Tanya and Tori. Tanya is an officer in the Hawaii Army National Guard. It's her on the top photo there. And Tori is a veterinarian currently doing a residency at the University of Florida. So we're very proud of our two daughters. I was a sales executive in advertising and sports marketing for over 20 years. And and about 7 years ago, at the age of 48, I was diagnosed with young onset Parkinson's, which affects about 4% of people who have Parkinson's worldwide. So I left my job and to concentrate on my health. Started working with a personal trainer about a year after that. And he did so much wonder for me that he encouraged me to become a personal trainer too. So so I thought if it helped me so much, I should help others as well. So at age 51, I switched careers and got certified as a personal trainer and also as a Parkinson Wellness Recovery or Power Move certified instructor. I started volunteering with the Hawaii Parkinson Association in 2018, maybe about no, 2019, sorry, about 8 months after being diagnosed. First, I was there, I just wanted to help them do some fundraising because I had a sales background, but they offered me a part-time position as an administrative and marketing support person. And then in 2023, I was elected president of HPA, and this past April, I was elected to my second and final 2-year term. So how do I live well, smile, and and live my best life with Parkinson's? So here are the key factors that I do. First, I need to be on the right medication plan, which means I need to work with my neurologist, be open and honest with her, and not only what my goals are, but what are my daily activities of life. Also means that I need to know how my body is feeling. So my physical and mental state affects the performance of the medication. Okay, so I know when my body feels well enough that I know my body well enough that I can feel when the medication is starting to wear off or when I have too much medication in my body. Okay, so I'm very aware of everything. Okay, so this is my daily medication regimen, and if it looks like a lot, well, yeah, it is. Okay, but it's also less medication that I've taken in a year ago. Okay, so this has actually been I was actually taking more medication before, and now I've reduced it down just a little bit. But basically, what I do is I in the morning I take a half a pill of carbidopa levodopa extended release or controlled release before I used to take one pill of that. And then 30 minutes after that, I take 1.5 carbidopa levodopa pills. I used to take the two pills at the same time, and then what was happening was I was getting a lot of dyskinesia because I was having too much dopamine in my system. So my movements were starting to be uncontrolled. So I started to spread it out, worked a lot better. So that's in the morning when I pretty much when I first wake up. After that, throughout the day, I'll take one pill every 2.5 to 3 hours of carbidopa levodopa. And then in the evenings, I'll bring it down to half a pill unless I have like a event or a softball game or something where I have to be more alert at night. Then I'll take one pill, but I'll take half a pill, and sometimes I'll even skip the last dose, the last half pill dose. I also take one entacapone, whichever with every carbidopa levodopa that I take. And then I take two amantadine pills, one in the morning, one in the afternoon. And then I also have the Pro, which is the rotigotine patch. I have that on as well, 24 hours a day. And then right before bedtime, I'll take another half a pill, the controlled release carbidopa levodopa. That's more for controlling any restless leg syndrome that I might have. Also take some supplements. Citicoline is one of that's been a game changer for me. Citicoline has been proven to lengthen the efficiency of the carbidopa levodopa. And so I take one pill twice a day, again morning and afternoon. Vitamin C packets. I take those vitamin C packets like emergency, and that's for again for keeping me healthy, but also for lengthening the efficiency of the carbidopa levodopa. And I'll take fish oil, magnesium, astaxanthin, which is marketed as bioastin, turmeric, vitamin B, super B complex, vitamin E and super B complex. Those are mostly for joint health and brain cell production. So my exercise routine. So what do I do? Okay, so I try to work out 5 times a week minimum. Right? Sometimes I get more off, sometimes I get less, but I focus on the following um, things that finding things to do for exercise. So strength training, high intensity interval training or HIIT, work as a personal trainer and playing softball twice a week is all the things that I do to help me stay healthy and live well with Parkinson's. So here's a few bits of advice for people starting on their fitness journey. Move big and fast, move with intent, repeat, 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 but learn something new. And finally, it's never too soon or never too late to to begin exercising, no matter what you do. And no matter what condition you have, if or what you're faced with, positive attitude is key to living well. Okay? When it comes to Parkinson's, I believe that if you're not on the right medication plan, or if you don't feel good, or if you don't exercise, you probably won't feel good. Okay, so so it's tough to have a positive attitude if you don't feel good, and so this doesn't happen without the other two. Okay, being on the right medication plan and being and exercising. By the way, the two rings is I earned that last year playing in a softball tournament. We took champs in a softball tournament, and I was named game MVP for one of the games. Playing on a team with all 20 and 30-year-olds too, by the way. So what keeps me smiling. So the reason why I bring up smiling a lot is because, as you know, people with Parkinson's tend to have mask face, so they don't smile a lot. So whenever I give speeches to people with Parkinson's, I always get this look, and I think to myself, are they engaged? Do they do they know what am I being funny or anything? And it gets tough to gauge how engaged they are, but they are engaged. It's just that they don't have we don't have a lot of facial expressions. So it keeps me smiling. So this is a question I get asked a lot. How do you keep smiling while living with such a cruel condition? So I found meaning and purpose. Okay. Aside from a cousin who just got diagnosed with Parkinson's, no one in my family has ever been diagnosed. I wasn't exposed to pesticides or chemicals, no head trauma either. But for some reason, I was diagnosed with Parkinson's. And I think I was diagnosed to help other people dealing with the same condition to let them know that they can live a good life or even their best life. I found my purpose in life. I'm using what could have been a tragic situation into a productive and meaningful life. It's not without its challenges, but in the big picture, it's been worth it. Okay. I stay true to myself. Okay. Yeah. I'm still a local boy from Kali. Okay. I like to play softball on the weekends and hang out with the guys and drink a few beers after the game. Okay. I go to UH games, I travel. Even though I have Parkinson's, Parkinson's doesn't have me. But there are times when you need to fake it till you make it, and that's when you need to live like you're in control. Okay. So you all saw how many pills that I take off throughout the day, right? So clearly I'm not totally in control of my entire life. But I don't live like I'm not in control. Okay. I live like I am in control. I just want to share a couple videos from last year. So in January, I participated in the Los Angeles Dodgers adult baseball camp, playing ten games in 5 days, 10 baseball games in 5 days, okay, with Parkinson's. And no one knew until halfway through the camp when I had to do a stand up and say, tell everybody that, hey, my name is Glenn Higa. I'm a certified personal trainer, and I'm also the president of the Hawaii Parkinson Association. So a lot of the guys came up to me and said, "Hey, how'd you get involved with the Hawaii Parkinson Association?" So I would tell them, "Well, I was diagnosed with Parkinson 6 years ago," and they were like amazed. Anyway, so the first video is a compilation of still shots. It's kind of choppy, but it was taken in my second at bat in the first game of the tournament of the camp. So check this out. It's me running to first base. There's a guy on the ground, and I need to jump over him. And I need to stick the landing. So I was out on the play. He tagged the base before I got there. But I didn't fall down. I didn't lose my balance. Stuck the landing. I jumped over him. And yeah. And so when I went back to the dugout, I asked the photographer, I said, tell me you got that. He did. Okay. Next video is from the All-Star game that we played. And so we played a Major League Baseball spring training stadium that holds 12,000 people.
51 Glenn
This is
Higa.
a dream come true for me right here. So to play in this camp was a dream come true. But to actually get a hit in the All-Star game under the lights in a 12,000 seat stadium, uh, that was uh that was a memory that will stay with me forever. So I want to close out with talking about the Hawaii Parkinson Association and what we do. So we're an all-volunteer nonprofit organization serving all islands in the state of Hawaii. We have a resource center in the St. Francis Healthcare Campus, which is where I am at today. We also as much as 15 support groups on 4 islands, Oahu, Maui, Kauai, and the Big Island. And we provide grants to exercise professionals who work with people who have Parkinson's. We host the largest free educational symposium for Parkinson's in Hawaii. We participate in educational and outreach events statewide. Finally, we hold an annual fundraising walk, which will be on November 1st at Magic Island. It's the walk is symbolic, but it's really meant to bring the Parkinson community together and solidarity and community. And best of all, for people who raise funds, 100% of all funds raised stays in Hawaii. We're an independent organization. We're not affiliated with any of the other Parkinson's foundations across the country. And finally, our mission is to positively impact the lives of those affected by Parkinson's through support, education programs, and other services. So the key thing there is people, lives of people affected, because we don't want to help just people who have Parkinson's. We want to help their care partners, their caregivers, family, friends, neighbors, colleagues at work, and so forth. I just want to say thanks to everybody for coming on and listening to me talk about Parkinson's and about my journey with Parkinson's and thank you to John and Rita Bell for inviting me today and I'll be happy to answer any questions that you may have. Thank you very much.
Thank you so much, Glenn. It's really a pleasure and honor hearing about you and your story. And um, what we might do now is kind of open up the question and comment section to our panel first and go through sort of different perspectives that folks might want to share from the panel, and then open it up to folks attending today. And some comments before I get there is Kopono says, so inspiring. Thank you for sharing. And question about, when our support groups, we can come to that later on. And Naomi says, thank you for sharing your journey, insights, and recommendations. Very inspiring. And I definitely echo that very much, Glenn. Very inspiring. So yeah, let's open it up to our panel. And Sarah, any
I'm still in
thoughts from
awe.
you?
I'm still in awe, but I when I saw that last video of you, Kevin, I said, "Come on, brother, get to the base, boy." So I want to say I love your competitive spirit and your motivation. I think that speaks to who you are to begin with as a person. That's all from within what makes you who you are. And regardless of whether it's Parkinson's or ALS or whatever it might be, I think you you just have it in within yourself to say, I'm going to take my situation and try to make the best of it. I think the only question that maybe you can help us all out with is, um, so my mother is living with Parkinson's, but it was really, really hard to get a diagnosis. Um, my sister and I kept trying to ask the PCP for some direction. So my question is, do you or anybody else out there have any suggestions how and who can you speak to in terms of a specialist? We think about neurologists, but how can we better advocate for our patients and families, Kevin, to get early intervention that you spoke of with the right specialist?
So that's a great question, Sarah. And the hard part about Parkinson's, in my case, was that my my PCP didn't have didn't have Parkinson's on her radar when she saw me, even though I had symptoms of Parkinson's. And I don't blame her because when I first went to see her about these symptoms, I was 45 years old, and no one thinks about Parkinson's at 45 years old. Like I said, the average onset is 60, right? So, and then as you get older, Parkinson's symptoms mimic aging. I mean, everyday aging, except for tremors. Tremors might be the only one that doesn't correlate to getting older. So it's a really difficult condition to diagnose. Um, Basically, it took me 2 years to go from first seeing my PCP to seeing a neurologist. Part of that was my issue because she said if you want to go see a neurologist, you can. And I told her, I said, do I have to? And because she initially thought I had an essential tremor. And so it took me a couple years to go from point A to point B. A lot of it is because when she asked me when if I wanted to go see a neurologist, I asked her, I said, do I have to go? And she said, no, I don't think so. And I said, okay, good, I'm not going because I'm a typical local boy. I didn't want to go doctor, and so forth. Finally, after 2 years of not getting better, she says, okay, maybe you should go see a neurologist just to rule things out. And so I did, and I was fortunate enough to go see a movement disorder specialist, which is a neurologist that has additional training in Parkinson's and other movement disorders. And within 45 minutes of a clinical clinical visit, she diagnosed me with Parkinson's. So and so in the meantime, I was going to physical therapy, and the physical therapist said, I'm not a doctor and it's not my specialty, but you show symptoms of Parkinson's and the only reason why I know that is because I work with a lot of people who have Parkinson's. So so that was my first inclination that I had Parkinson's because I didn't want to go to like WebMD or Dr. Google and look up what's wrong with me. I just didn't want to go down that rabbit hole. So basically, yeah, that's the only way I got diagnosed.
Yeah, thank you for those insights because my mother had tremors on her mouth and the PCP said that's aging, but it wasn't. She also had restless leg syndrome.
Yeah.
So it took us 2 years.
Yeah, and that's common for people. I mean, I was diagnosed with a frozen shoulder instead of rigidity from Parkinson's. They took they took a CAT scan on my or they took scans of my X-rays on my back, and they said, "Oh, you have a slip disc. Maybe you need to operate on your back." And I was like, "Whoa, whoa, whoa, whoa. I mean, can we think about other things first before you treat me like a pincushion?" And so anyway, so yeah, but the frozen shoulder one is really common. I work with a lot of patients who have Parkinson's, and almost all of them have been diagnosed at some point with a frozen shoulder.
Thank you, Glenn and Sarah. Yeah, definitely highlighting the complexities of diagnosis. And I'm, that can probably be a long struggle like it was for you, for a lot of folks getting that accurate diagnosis to help you move forward. Thank you. Rita Bell, any thoughts or questions?
Thank you, Glenn, for doing a Hanaho presentation to our Echo Geriatric Clinic. We are just so inspired and amazed by you. This is the highlight. You kept me on a high now for the whole day, for the whole week.
Thank
Thank you
you.
so much. I just want to highlight about how frustrating it is, our current system in medicine, for a doctor to prescribe physical therapy, a person has to either fall or something, come out of the hospital. We have so many limitations to give the benefits of physical therapy, and then we can only go for so many sessions. So that is really one of the sad limitations in our current system of managed care. So I want to thank you for being a personal trainer, because we need more personal trainers to get people to go to the gym and exercise, because exercise is the best pill. As you said, that is the magic bullet, and I'm so glad we have personal trainers like you. Thank you.
Thank you. And we need more. We need more personal trainers that want to work with people with Parkinson's. But it's it's for for most personal trainers, it's not the easiest group to work with. You have most people with Parkinson's are older. They a lot of them have never participated in any exercise before. And and unfortunately a lot of them are almost towards the end stage of life already. So it's tough when you can be a personal trainer and work with people who are training for sports, for athletics, for weight loss. That it's much more I guess it depends on your perspective, but to me it's much more rewarding to work with people who have Parkinson's, because you can totally change people's lives. I mean, I've had clients that they came to me in a walker, and within a year, or yeah, within a year they're walking around, and on the way to hopping and skipping and jumping. So we know it works. Yeah.
That's awesome. That's really amazing. Yeah, thank you. Courtney, how about any thoughts from a nursing perspective?
Thank you. I think I share the sentiment of just kind of feeling really inspired. It truly, your story, there's so many kind of from diagnosis to kind of early onset, to managing the disease and the working with your providers and changing your medications and your activities of daily living to really find what works best for you. It's really inspiring, and it really shows me kind of how that purpose comes through and translates to how you live and be in your life. And that's something that I think I really care about in my practice is value-based care, not value-based care from a medical kind of standpoint, but ensuring that people, as older adult or younger individuals, are living their life in a way where they feel like they have quality and value and they can thrive. And so it's really really nice to hear your story, but I was curious from your perspective, since you work with other individuals with Parkinson's, and it can be this really daunting diagnosis of this neurodegenerative kind of condition, how you may kind of foster and help others find purpose, so that they have the will and the drive to kind of wake up every day and work through the disease and still find meaning, purpose, value, and happiness.
Yeah, that's not an easy proposition for a lot of people, because I've talked to people who have just given up, and within 2 minutes of their diagnosis. They say, "Well, that's it, my life is over." It started really from my first neurologist, where she told me, she said, "You can live with this. It's not going to be an easy journey, but you can live a long, good life with Parkinson's." So had she not told me that, maybe things might be different, maybe, but but at least she had the bedside manner to tell me that this is a journey that can be still fulfilling. And so that was what set me my journey. Um, in terms of like I always talk to people about what are their goals in life, what are their future goals, what things do they want to see, you know, and and it doesn't have to be running a marathon, it doesn't have to be anything physical nature like that. But I said, do you want to see your kids get married? Do you want to see your kids graduate college? You want to see you want to be able to walk your daughter down the aisle. You want to be able to hold your grandchild. You want to be able to take a trip with your wife and so forth. Do you want to still work in the yard? Do you want to go and play softball? Do you want to take a cruise around the world? Whatever it is. Or do you just even want to get out of bed and be able to walk to the bathroom on your own, without having to use a commode? So so those are I find inspiration from a lot of other people who have Parkinson's that do amazing things. Kevin Mokuahi is a friend of mine. He has Parkinson's. He's had Parkinson's for 17 years. He just did a race last year where he raced up Haleakala, 33 miles from Paia all the way up to the top of Haleakala. And and that's inspiring to me. I mean, this guy, I witnessed this first time. I wish I took a video of it, but I was so shocked that he would do this. He, on a bike, he actually could put a jacket on with the sleeves on and everything and not fall. I told myself I can't even walk and put on a jacket. So to see you put on a jacket and riding a bike up Haleakala was amazing. And so Kevin always says, "What is your mountain?" Okay, and that's his mantra for everybody. What is your mountain? Okay, your mountain may not be Haleakala, it may be maybe a smaller hill, and no matter what it is, but it's important to each individual. And so I take a lot of inspiration from people like him as well.
Thank you so much for sharing.
Thank you.
That's awesome, and it's yeah, clear that having focusing on values and what's important in life, I think, can touch on everybody's practice here, and no matter what field that they work with people in. And I think that's a really awesome reminder to us. Well, Reese, how about any thoughts from you?
Yeah, thank you for sharing your story. I had a question. So you showed that you're on a good amount of medications. What are your recommendations for patients and their caregivers in terms of managing the medications? Do you recommend using a pill organizer? Or you mentioned also that you if you feel like a medication's wearing off or weaning off, or if you have maybe too much of the medication, maybe the dose was a little high. Did you keep a medication diary, or how did you track that to learn how each medication affects your body so that you could work closer with the doctor to optimize your therapy?
Okay, yeah. So I use a pill container. In fact, I have two pill containers. One in which when I go out and do things, so it's easier to take the pills out of the pill container, just because some fine motor skills are severely impacted by people with Parkinson's. So grabbing a pill sometimes can be a chore. So so I use one that's easier to take pills out, and then I have one when I don't have to go out and do things where it has more days worth of pills inside that container. Um, I know there are some people that I work with that basically rely on their care partner or caregiver, like their spouse or their children, to to take their medication. And I don't recommend that, because what I always recommend to people with Parkinson's is be your own advocate. Know your own body, know how you're feeling, know what medication you're taking, um, and and just don't be so dependent on others. And then in terms of medication for Parkinson's, it's kind of like Goldilocks. And because if you have too little bit medication or too much medication, you don't feel good. Okay? And that's where the dyskinesia pops in. That's where the slow movements of bradykinesia pops in. That's where that's where just things go haywire. But when you have the right amount of medication, you feel good. Like like I I would tell people when I used to work in another gym that that if I was on medication or if my medication was working, I can drive like I was 10 years old and I stole my parents' car. Okay? But if my medication wasn't working, I drive like a 80-year-old woman in the fast lane of H1 like this. Okay? Just clutching the steering wheel. So that's the difference. So I know how my body's feeling when my medication is is working, when it's not working, or when it's wearing off. And then in terms of keeping track of it, I used to I used to keep detailed tracking of it, and it just got time consuming. I think I was like over paralysis by analysis in a lot of ways. It was just too much. But there are some tools online, and there are some apps. Strive PD is one that a lot of people use, and they seem to and it works for a lot of people. Um, I I keep reminders on my phone, so when it's time to take my next dose, it rings me and I take a dose. And other people use the app like Strive or APDA, American Parkinson Disease Association has also has apps as well. So you can find apps all over.
Thank you.
Thanks. Thanks, Glenn. A lot of that practical stuff makes all the difference to folks day to day. Yeah.
Yeah, it's little life hacks. Yeah.
Totally. Right. Right. Um, well, and Chris, how about speaking of physical therapy?
Yes, thank you. Thank you, Glenn, for your inspiring life's journey with Parkinson's. We truly do see that with our therapy services. So, with your story about the medications and how it does affect in the time of day, we definitely do see that with therapy. So if we have a client who has Parkinson's and he would let us know, I'm better at this time because then my medication has taken effect. And so we can have a better benefit with the exercises that we do. I appreciate your sharing of your exercises that you do too. All of that is important. That reciprocal training between arm and leg movements, the running, the HIIT. There's also the LSVT programs for the voice for speech therapy to help with the Parkinson's patients who have, because they start talking a little bit softer. So being able to provide them with that voice quality so that they can get the care they need or to voice to their caregivers what they need. The LSVT big program also helps with those bigger motor movements. So like you said, move big, move with that intensity. And that's really the training that we've seen that's helped the Parkinson's patients move through their continuum of their disease process. So sometimes like where you're a high functioning Parkinson's patient, we can do things like the running and everything. And then as they start to decline a little bit further in their progress, we may need a little bit of support. So standing with those big movements and high amplitude training exercises. And we even can go into those that are a little bit more bedbound, where we can help caregivers also with those movements to help with decreasing some of that rigidity and stiffness. So I appreciate everything that you've discussed and all the information you've provided. We do see that in the therapies that we do provide. Yeah.
Thank you. Appreciate that, Chris.
Thanks, Chris. Yeah, really cool information. And I can share a little bit and maybe ask a question from my work as a psychologist. As a geriatric psychologist, I get a lot of referrals for clients and patients with different challenging situations like Parkinson's disease diagnosis. And sometimes it's the diagnosed person with the diagnosis, and sometimes it's family members and caregivers, right? Um, and one of the things that is challenging sometimes for the person with diagnosis and the family members is that you know maybe you have identified the mountain, your mountain that you're going towards, and sometimes you are making progress and you can achieve that, and sometimes you can't, right? And there are points at which maybe a mountain that you thought was possible is kind of clear that that's no longer possible, and that kind of dealing with that, maybe redefining the mountains or kind of moving forward in a different way is a lot of, it's a lot of the work we do. I'm just wondering if that comes up for you in your work with your clients in physical therapy, and how do you approach sort of when the goals need to change because of the change in the illness?
Yeah, that does come up because it's a progressive condition, right? So it's going to get worse over time. Exercise is the only thing that's been proven scientifically to slow down or even delay the progression of Parkinson's. In my case, my neurologist now says that my Parkinson's has actually regressed um, from when I first saw her to where I am now. But I do feel like that it's starting to progress a little bit more just as I'm getting older. So that's my feeling. And so so for me personally, I mean, I love to play softball, and so, but I'm being honest with myself, and I say I'm not playing very well now, and so so I'm beating myself up over it, because am I getting older? Is it the Parkinson's? Is it the competition's getting better? Is it all of the above? And everyone that I talk to, they said they always tell me like, at least you're playing, at least you're playing. And and they said, you got a lot of your friends, they don't even play anymore, for whatever reason. So at least you're playing. So when it comes to my clients, I mean, um, yeah, it's one of those where we always talk about goals, and I have a client who likes to paddle canoe, and he can still do it, but he says it's getting harder. So we talk about managing your expectations, okay, and also just reality of getting older. Father time is undefeated. So so Parkinson's actually speeds up that time as well. So yeah, so we do talk about managing expectations and just being honest about it, and just saying, hey, we're not supposed to get better as we get older necessarily. We can, but that's not usually how it works.
So kind of bringing in yeah, the perspectives that, like, none of us are you know immortal, no matter what we have or don't have. And so that being folded into that, the balance between that serenity prayer kind of approach, which is like, do what I can, right, and then accept what I can't change. And so that sort of ongoing balancing act is the challenge.
Yeah. And what I do a lot of times too is I'll tailor their workouts so that it challenges them, but they can also be successful at doing things, so that they feel like they get some wins in there, and then there's some things that make them challenge, and when they get the wins, then they feel like they can accomplish more. And then when they can't do something, then it drives them even more further to work harder. Because one thing about people with Parkinson's, we are very stubborn. We are very bullheaded, and if you tell us you can't do something, we're gonna try, and we're gonna try hard. That's one thing about people with Parkinson's. Yeah. The ones that are I mean, not all of us, obviously, but there's some that just give up. But the ones that want to be successful, they'll run through a brick wall to try and be successful.
Well, thank you very much. So just a few minutes, and for folks in the chat, I'm sorry, and a couple questions about sort of accessing support groups and you yourself, personal training. So one question, when and where do you meet for support groups, or how to find out information about available support groups, I guess?
Yeah, so go to our website, parkinsonshawaii.org, and look for the tab that has the support groups on it. I think it's under resources, and click on support groups, and then there's a laundry list of all the support groups that are available. Some meet via Zoom, some meet in person, most meet in person. And support groups are what we consider the first line of defense against Parkinson's, because if you are just isolated or alone, you're not going to get better. You need that social interaction to get better. And so it's my goal that anybody with Parkinson's should never feel alone or isolated. Now, if they want to be alone and isolated, then I can't help that. But if 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 they know other people have Parkinson's, then they have a chance to talk to, share best practices. They can share what works for them, what doesn't work for them. They can ask questions of each other. So I think it's very cathartic and very helpful. Yeah.
Thank you. Yep, I totally agree. Support groups, so critical. Support of all kinds. So question, and just I'm conscious of the time, I want to remind folks who are attending today, if you are looking for CE credits, please complete the evaluation, which was posted on the chat a few minutes ago. And if you have to leave, no worries. Hope to see you soon. But a couple more questions from the chat, which is, what is the best way to refer people to you for personal training? And I'm sorry, where do you provide your services?
So I'm here in St. Francis, in the Kapuna village, in Liliha. I'm using the fitness center here, and best way to reach me is give me a call or shoot me a text, 808-348-2767, or I can be reached via email, Glenn, Glen, M as in Michael, Higa, Higa @gmail.com.
Okay, great. I put those up in the text, and hopefully someone can double check those for me. And also you put them in your slides, which will be available. Is that right, Sarah? At some point? Yeah, okay. Excellent.
Yeah, they'll be available. It's been recorded.
Excellent. All right. So ways to get in touch with you. A few more folks wanting to thank you, Julieta and Marina, also sharing their appreciation and the inspiration that you provided them. So yeah, really want to mahalo you from all of us, Glenn, and just the inspiration that you can bring, the advice, the information to share with patients, and really valuable today. So mahalo nui.
Thank you. Appreciate that. And yeah, just encourage your patients to keep moving, never stop moving. And and if they have Parkinson's or any kind of chronic condition, that you can live a good life, and it's not a death sentence by no means. And yeah, just thank you again for allowing me to share my story. Really appreciate it.
Well, that's a wrap for today, everybody. It's 1 o'clock. Have a great rest of your day and week, and hope to see you again here for the next Geriatric Echo. So,
Thank you.